Welcome to the McClosky technique. Without further ado, let's dive into our first exercise, the facial muscles. Using 2 or 3 fingers, gently massage the forehead muscles in circular motions. Next, we move down to the temple muscles, same circular motion. And following that, we have the cheeks. As we do so, let the jaw hang freely with the lips and teeth separated in a natural, relaxed manner. Now, we move to the chewing muscles just in front of the ears. Spend more time on the temple and chewing muscles, as these are the regions where we tend to feel tension. Finally, we have the upper lip region. And lastly, the chin. With that, we move on to our second section, the tongue. Let the tongue gently fall forward from the lower lip. This motion should be natural, without effort from the jaw muscles. Make sure that the tongue is in a nice U shape, instead of having a pointy tip. Alternatively, we may also rest the tongue atop the lower teeth. Repeat this exercise several times until we feel decreased tension in the tongue. In this next section, we move to the swallowing muscles. Using the pads of the thumb, place them just under your chin. When you swallow, you should feel a pair of muscles contract. These are the swallowing muscles. Gently massage this muscle using an up-down pressing motion. We can continue this massage for the rest of the muscles along the jawline. Now, we move to the next section, the master muscles. Let your jaw hang freely with the mouth slightly ajar. Now, using the back of your index and middle finger, rest them beneath your chin and gently push upwards to close the jaw. It is normal to feel resistance. This means that the master muscles are still tense. Repeat this exercise until you feel decreased tension and resistance. Moving on, we have the larynx muscles. Place 3 fingers at the front of your neck. Now swallow. You should feel your larynx moving up and down. With your thumb on one side and the rest of your fingers on the other, gently hold onto your larynx, slowly moving it from left to right. You may feel slight clicking. This indicates that the strap muscles of the larynx are still not relaxed. Keep repeating this exercise until the clicking sensation decreases. Lastly, we have to place our head atop the AO joint. The AO joint refers to the place connecting our head to our neck. To identify the AO joint, place your index fingers just in front of your ear canals. Imagine both fingers extending into the back of your head. The place where they would intersect constitutes the AO joint. Now with your hands, gently lift your head upright as such. This is to balance your head on top of your spine. Now we can gently turn our head in a left to right motion, keeping the head at eye level. We can also move the head in an up-down motion. The head should feel weightless. This concludes the end of our head and facial muscle exercises. Next, we move onto our body posture. A correct body posture would help greatly with breathing and phonation. First, stand with your feet shoulder length apart. To balance your body, you may place one foot slightly in front of the other if needed. Place your body weight onto your feet. If you lean slightly forward, you should find your toes grabbing onto the floor. Whereas if you lean backwards, the weight of your body should shift onto your heels. Now, bring your body back to the balanced position, where the weight is evenly distributed on the feet. Next, we unlock our knees by relaxing the kneecaps, such that the knees are neither bent nor locked. Following this, place the right palm on the lower abdomen, with thumb on the belly button. Place the other hand on the same level on the back of the abdomen. Now rotate the pelvis in a tuck-in manner, such that the posterior feels lower and the spine feels extended. As an alternative, we may also use a wall for assistance. Standing one step in front of the wall, bend your body at a 30-degree angle. Lean backwards onto the wall, such that the posterior now touches the wall. Now slowly bring the rest of your upper body upwards to lean against the wall. You should feel the arch of the spine where there is no contact with the wall, and you should be able to place your hand through it freely. Now, with the right palm placed on the lower abdomen like before, gently tuck in this region such that it now rests upon the wall. You will find that you will no longer be able to fit your hand through the arch like before. This exercise will lengthen the lumbar spine and stretch the muscles on the lower back. Take note that the upper body should not become slouched when attempting to tuck in the lower abdomen. We move onto the rib cage. To achieve ideal openness of the rib cage, stretch your arms at your shoulder levels. At this point, you should feel that the rib cage is being lifted. Slowly lower your hands, but maintain the stretch of your upper body. Now your standing posture should be aligned, and this maintains the control over the fine balance between the abdominal and intercostal muscles. Lastly, we approach the breathing section of this technique. First, allow the breath to come in through the nose, with the mouth slightly open. Now, place one hand on the chest and the other hand on the abdomen. As you breathe, you should feel the abdomen expanding. This indicates proper expansion of the diaphragm muscle. You may also feel the chest expanding and rising, but this chest expansion should not be greater than the abdominal expansion. With the proper technique, we can now attempt McClosky's breathy sigh as such. Ha, ha, ha. We have now reached the end of this tutorial video.